CHG.
Chlorohexaglutaraldehyde.
And what?
Glutamate or something.
Yep, exactly. So this is what it looks like. CHG prep. It looks like sort of like a peel pack sort of thing. These are the cotton swab. It always comes with 2 and the stick. Okay. The stick is to clean the belly button, which we don't have a belly button, but I'm just gonna pretend and show you guys. So with prepping, we always use open gloving technique. So you guys get to practice and you will be graded on open gloving. Okay, kind of going back to first quarter. This is the Betadine kit. I'll just open it up. It's wrapped up just like this in an envelope. There's normally a sterile glove in here. We don't have to use this. There's some towels, more paper towels, and Betadine, sponges, and more Q-tips. Just put this back correctly. I'm just gonna toss this out because we're not gonna use this. I'm just gonna just sit over there. Yeah, thank you. They're normally really one size fits all, and they're super big. So, okay. So before we get started, where do we prep for X-Lab?
This is the belly button out.
Like where to where?
Nipple to groin.
Yep, nipple. Yep, exactly. All right. So on your test or just in general here on out, you guys should pay attention to patient's allergies. So sometimes they have CHG allergies, meaning that we cannot use CHG, right? So they gotta use Betadine. If a patient has allergies to shellfish, which one do you think we should use? Exactly. Yep. Okay, good. So you guys already know this part. Open gloving. So what you'll do is pull down the sheet. Let's say I'm gonna do this first, okay? So what you'll do is you can open up this package, and a lot of times you either work off a little rolling mayo stand. For this demo, I'm just gonna put it on the patient. And some circulators do that because you're covered with blankets already. This is your surface area, okay? So you would just open up this like normal flap. Probably more down here. Okay. And then you would do your open gloving. So I'm just gonna put my gloves on. Open gloving. So the real open gloving technique. Oh, these are so tight. Okay. You will set this on the side. This is your little surface area to work on. And remember, the 1-inch rule does apply to this. Okay, so you will work in this little square here. What you'll do is you'll open up this. This is all pretend, okay? You'll verbalize opening the cap, dumping Betadine onto the sponges into the little tray here, okay? So now that we did that, you will open up this. This is like a half drape. We'll tuck it in on the side of the patient so that when you prep, it doesn't pull underneath and this catches it, okay? So same for the other side, you will just come around. Open this up. And do the same, tuck it on the side. And this quarter, we're also gonna show you guys how to put the arm boards on so that the arms is sticking out, okay? So now, where's my Q-tip? So Q-tip, dip into the Betadine. This is the belly plug and we're gonna pretend, okay? So doing this, and you can toss it right here, circle, inside the belly button and here. Now, you would get the sponge and go in circular motions. So going from the belly button out in a circle, okay? This is dirty. Then you'll have a strip here. Then you will do on this side. Get rid of it. Same thing on this side, okay? And It just really depends on the patient's anatomy. If the patient has a really big belly, then of course you probably need to like split this area in half, right? So it just depends. Now that we're done, we'll do the final dapping because the betadine is very wet, right? So what you'll do is you'll sit this on here and just dab down. And you'll pull from one side in the middle and snatch it, and these are all trash.
And you have to walk around to sponge the other side, or could
It
you?
depends on if you're finished up, then you can start with that side too.
Okay.
Then for this drape down here, you want to pull from the corner, doing this, so that it doesn't go backwards. Okay, and this is the same from here, like down the corner, and just gonna pull it off, and that's all trash. And then that's it. Okay, so I'm gonna give you this.
I don't know if this
Yep.
is a dumb question. When does the circulator do this during our procedure? Like at what point
I'll
would they?
have-
Usually, if you guys do it, usually, right after the count, you guys can start prepping the patient, and I'll give the tech time to finish doing the little things they need to do or whatever while you're prepping the patient.
Okay, so after our count.
Yeah, and for this test, we're
Yeah.
kind of sticking with that because in
Yeah.
the real world, it doesn't really happen like this.
Yeah, no.
It's more of surgeons already being gowned and circulators quickly prepping.
Yeah.
So we're gonna give you guys, how many times, we give them extra,
Yeah,
just
a
like,
Couple
so,
extra minutes,
couple,
yeah.
couple extra minutes, like if you're not done prepping, like we will, before we drape, we will let you prep, like the circulator prep. Cause this is new to you guys. Okay,
And do
So
we-
it won't take time from the tech?
Yeah.
It won't take.
we're not taking time from anyone, but we want you to do the whole prepping. Yeah.
Okay.
Yeah.
And the circulator will just start doing it, we don't have to verbalize, can you prep the patient, they'll just go and do it,
Yeah, you can just verbalize, I'm prepping the patient.
okay.
Then
Yeah,
you'll
just
walk
let your
over.
tech know that you're about to
Yeah,
prep the
just let
patient, so
them-
they
I'm
know
prepping
that
the
you'll be
patient.
busy for a minute.
Yeah,
And
cause
then-
sometimes, a lot of times surgeons are already gowned, and we're just standing there, like, kind of watching you prep. But we're giving you that leeway, because normally it'll happen at the same time in
Yeah.
real life.
Okay.
Yeah, but we're gonna give you that time, so you're not being timed, circulator is not being timed for prepping. We just wanna make sure you know how to prep. Yeah, okay, so now, again, same thing, I put my open gloves on. You will open this packaging prior to putting your, open gloves, right? Once you have it on, you'll carefully take this out. This, you can actually pop it and shake it and squeeze it a little bit. The solution comes in here, which I don't wanna do it because it's gonna be a hot mess. And it's gonna be orange everywhere. So what you'll do is same thing, you'll dip the solution with a Q-tip, belly button, same thing in circular motion from umbilicus going all the way out, okay? Then you will come on this side and then come over to this side and do the same. Now, the thing with CHG, you wanna make sure there's a dry time of 3 minutes. So we want you guys to verbalize.
Cause it's the final one, right?
Exactly, yeah, we wanna make sure that the prep solution is completely dry. So circulator is, we will expect you to announce 3 minutes from now. So looking at the clock, and it will be what time? So for example, what time is it? What time is it now? So let's say I finished prepping at 7:26, you're ready to drape at 7:29. You wanna verbalize that.
But we're just verbalizing, we're not actually waiting that time.
No, we're not waiting.
Okay.
Yeah, just wanna make sure you verbalize. Okay. Any questions?
And we're prepping all right here, I'm sorry. Where-
So we're gonna do the first prep and that's gonna be the second prep too? as
Wait,
well?
No, you only do one.
There's one
prep.
prep.
Either.
It's
Okay,
either
just
or,
making
so you're
sure.
either allergic to that, or it could be
Okay.
surgeon's preference,
Yeah.
sometimes surgeons, they prefer to do betadine, they don't like CHG.
Okay.
Or it could be an allergy, it really depends, so,
But you'll do one or the other.
one or the
Not
other,
both.
yeah, you wouldn't have to prep with both solutions.
And we are opening up here, this is how we're
You can
gonna do
open it up here,
That's
that's
how we're
fine,
doing
yeah,
the test.
cause we don't have a little rolling
Yeah.
nail, I can't expect you guys to do that, so just put it right here, so this, and yeah, this is perfect, yeah, cause we do this in the real world, so. Any questions? No? No? Good? Everyone good? Alright, so you guys can add this part to your procedure today.
Cool.
And we'll start playing